Am I suitable for a facelift, a neck lift, or a combination of the two? This is one of the most common presentations I see patients for. The common thought is that face and neck lifts are only for those who are much older, usually starting at age 50, 60, and so on. This, however, is not necessarily the case, as there are a small subgroup of younger patients who have face-related changes that have appeared quite quickly despite their young age. There are also a subgroup of patients that have deep, heavy necks that may benefit from a limited incision neck lift. A face and neck lift suitability is usually judged by seeing a facial plastic surgeon who is able to then guide you with regards to what you will require. How long does a facelift last for? This is, again, a very common question that patients ask me. Unfortunately, there is no way that anyone can predict the exact longevity of a facelift. However, there are signs that we can pick up that may suggest that one individual's facelift may last longer than another. These factors include the quality of the skin, the quality of the underlying tissues, the extent of sun damage to the skin, and generally things like their medical history, whether they're a smoker, and how well they generally take care of their skin. All of these factors can influence the longevity of your facelift. It is also very important that following a facelift, one initiates some maintenance treatments such as peels, resurfacing treatments, and also having a good skincare regime to ensure that the facelift they've had lasts as long as it can. In short, it's difficult to predict the longevity of a facelift. I personally use a deep plane approach, which has been proven to be the most effective way of lifting drooped facial tissue, as well as ensuring a longer lasting result, and that's the procedure I would recommend. However, this is about how long the result would last, and so in summary, the length and the longevity of a facelift is difficult to predict, and it is individualized to each patient. So, risks and complications of facelift surgery. I like to talk about risks by dividing them into risks of an operation, which are the standard risks of any operation, and then risks that are specific to the procedure a patient will have. So standard risks include infection, bleeding, pain, scarring. This is all possible in a facelift. Specific risks when it comes to facelifts include damage to the facial nerve, seroma formation, and skin flap necrosis. If you add neck lift into the mix, then this increases the risk of bleeding and further increases slightly the risk of facial nerve damage depending on what type of neck lift is performed. Overall, however, when it comes to infection, we give patients antibiotics to reduce this risk. Bleeding is reduced by using substances such as tranexamic acid and maintaining meticulous hemostasis. Pain is dealt with by providing adequate pain relief, and scarring is reduced by performing the incisions for the facelift in a very careful and considered manner to hide them and camouflage them as best as we can around the ear and back of the hairline. The other risks, I try to mitigate them by using a safe technique of dissection. Recovery following facelift surgery. The recovery following facelift surgery is usually around 2 weeks. By around 2 weeks' time, you will see about a 60 to 70% improvement in the swelling and bruising following facelift surgery. Of course, this is individual to each patient, and you may find that you heal a little bit slower, and therefore it may take you 3 weeks and sometimes 4 weeks. In rare occasions, it is possible that you're a very good healer and therefore most of your swelling and bruising settles down before the 2-week period. Healing and recovery can be enhanced by doing things such as wearing a compression garment for 24 hours a day full-time for 2 weeks, by taking supplements such as arnica, vitamin C, and also making sure that you stay away from the sun and cleaning the incision lines and sleeping with your head at around a 45-degree angle. Of course, sun protection should continue for several weeks, if not months, following facelift surgery, and this may include the use of sunscreen as well. With regards to recovery, you will find that in my patients I use non-dissolvable stitches in the facelift incision line because in my experience these stitches give a much better outcome in terms of reducing scarring and making the incision line heal very well. These stitches usually come out at a week, although if I have any concerns I may leave them for a little bit longer. This is of course part of the individualized treatment that you will receive under my care and at the Centre for Surgery. The cost of a facelift. The cost of a facelift is dependent on numerous factors. These include the type of facelift that will be performed, the complexity of the individual case, the need for additional procedures such as deep neck work, a peel to treat superficial wrinkles, liposuction to treat fat around the neck area, and so on. Sometimes you may be able to also include a brow lift and upper and lower lid blepharoplasties. So all of these need to be taken into account when pricing up a facelift. This all means that time is required in theatre for all of this surgery to take place as well. So the cost of a facelift is dependent on all of these factors. At Centre for Surgery, individualized plans for finance can be provided, and please speak to one of our patient coordinators who will be able to guide you with regards to this